Hello students, welcome to this session of sterilization. In this we are going to study about autoclave in detail. Hello students, let's study moist heat. So in that we will see autoclave in detail. So it also called as steam sterilizer. The principle: when water is heated in closed container, it produces vapor and then it causes vapor pressure. Then when water boils in closed container, the vapor pressure is increased more than the atmospheric pressure, and then it has a more penetrating power to kill the organisms. And the mechanism: killing of organisms by irreversible coagulation, denaturation of enzymes and proteins. The types of autoclave are horizontal when it is in large volume, and it is mainly used in CSSD department. And the vertical one is in small volume, used in most laboratories. The components: there are three main components: pressure chamber, lid and electrical heater. So pressure chamber is consists of the large cylinder, either vertical or horizontal. It is made up of metal or stainless steel, and it has a steam jacket, that is water compartment at the bottom. The lid: it has discharge tap for passage of air and steam, a pressure gauge for the pressure measurement, and safety valve to remove the excess steam. An electrical heater: it is attached to the jacket that heats the water to produce steam. The working procedure: the materials to be sterilized are placed inside the cylinder. A steam jacket is filled with sufficient water, and then lid is closed with the help of clamps, and the electrical heater is put on. Now there are three phases. So first is conditioning phase, second is exposure phase, and third is the exhaust phase. So in conditioning phase, you have to give condition of temperature, pressure and time. That is temperature 121 degree Celsius, pressure 15 lbs and time 15 minutes. So after the water boils, the air in the chamber is completely displaced by the steam. So the steam pressure rises and then it reaches to the desired level, that is 15 lbs pressure. Then the safety valve opens and excess steam is removed out. Exposure phase: the holding period is for 15 minutes. Exhaust phase: so after the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure, and then the material inside is removed out. The care and maintenance of the autoclave: so we have to always put water in steam jacket. Do not forget to put off gas burner after the holding period is over. Never leave autoclave unattended when pressure is rising, and never open the lid immediately after heating period is over. So we have to allow it to cool and then open the lid. Sterilization control: physical conditions like temperature, time and pressure. Chemical indicators like external pack control, that is autoclave tape, or Browey test or internal pack. The biological indicator: spores of Geobacillus thermophilus are the best indicator which kill spores, in which the spores are killed in 12 minutes at 121 degrees Celsius. Uses of autoclave: so there are mainly two uses: hospital uses and the laboratory uses. In hospital uses, the sterilization of surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, surgical drapes and linen, biomedical waste treatment for disposal. Laboratory uses: sterilization of glassware, test tubes, slides, pipettes, petri dishes used in the laboratory, sterilization of culture media for preparation, inoculated infected culture plates, killing of microorganisms and the spores. Flash sterilization: it is modification of conventional steam sterilization used for the emergency or during unplanned procedure. So it involves fast sterilization, that is temperature 134 degrees Celsius for 3 to 10 minutes. For surgical instruments in unwrapped condition in steam sterilizer located close to the operation theatre, and it is restricted for emergency situation. Disadvantage: not suitable for porous or cannulated instrument or implants because the instruments are not packed, so they remain wet following sterilization and there is high risk of recontamination.
I hope this session you will find useful. Thank you.